I wanted to take a moment to talk about thigh contouring because this is one of the most intricate and difficult areas to achieve truly excellent body contouring results. When we look at these patients, we have to very carefully assess their anatomy, see how much fat there is, see what their skin tone is like, and design the right treatment accordingly. So, for example, in this patient here, this is a young, fit woman. She has fairly good skin tone, and she just wanted her thighs to look a bit more slender. She wanted to preserve the curvature of her outer thighs, but she didn't want to have that pronounced fullness in the outer thighs that sometimes is referred to as a saddlebag area. So you can see that the result we achieved for her here got rid of that fullness, but it did preserve the curvature for her, and she was treated with vaser-assisted liposuction. I did not think that she needed body tight for her outer thighs. That's kind of a very powerful, minimally invasive skin tightening device. And often I won't use that for the outer thighs because that skin tends to fall towards the body in a more flattering way, even if there is some laxity there. This patient, on the other hand, had significant fullness of her inner thighs. We did treat her with vaser-assisted liposuction and body tight, and we achieved this result for her. If you look closely, you can see that she still does have some skin laxity. This is a patient who, to achieve a really perfect result, would have benefited from a medial thigh lift or a mini thigh lift, but she just did not want to have a surgery like that. She didn't want the resulting incision, which is in the groin crease. She didn't want the downtime. So she opted for this minimally invasive approach, and this is a very nice result. But again, we have to make sure that we're matching what we're delivering to our patient's expectations. And finally, this is a patient who is, again, young and fit, and we contoured both her abdomen, her waist, and her circumferential thighs here, and we didn't use any body tight at all. We just did vaser-assisted liposuction, and we were able to get a very nice contour without any significant skin laxity because, again, she has nice, tight skin. So getting great results with lower extremity contouring comes down to evaluating the patient's anatomy, evaluating his or her expectations and desires, and really designing a customized approach that accounts for what a patient's ideal results are and the kind of surgery, the kind of procedure that they're willing to have.